Hi everyone, it's Jennifer Lattes, Mulling Mortician, and today we're going to talk briefly about personal protective equipment or PPE and its use in the funeral home. Now, there are a lot of resources out there that discuss PPE, but many of them use it in context of working in like a hospital or medical facility. And while similar to what we do, I wanted to speak about the specific uses that we may find ourselves incorporating PPE in our unique circumstances. So we will be exploring that together today. We're going to identify PPE items and then talk about when PPE is necessary and what PPE you're going to grab, depending upon the situation. Because as you know, within funeral service, we can be exposed in different ways at different levels to different things. So that's kind of what we're going to talk about, how we would tailor our PPE selection based on that. We're going to describe how you properly don or put the PPE on, as well as doff or take the PPE off. Okay, there is a sequential follow with that. And so we're going to talk about that. And then the limitations of PPE. It does not make us invincible. We're going to talk about that. It is helpful, but it has, as described there, the limitations. We're going to talk about how to take care of and maintain your PPE, what the lifespan of those items are, and then finally how to dispose of it properly. And we'll circle back to some key points in conclusion. Now, first of all, let's talk about what items or elements make up PPE. So you have the bold printed ones there, which are gloves, gown, and masks. And those are recognized by like CDC. Those are the basic items. So we'll start with those. Now, your gloves should be disposable gloves. They're not the reusable gloves you can find yourself using if you're working on like a housekeeping task. The gloves will vary in thickness based upon the task. We'll talk about that. The gown that you'll wear when you're working within the funeral home there, it should be a long sleeve gown and it should be impervious to liquids. Ideally, it should go completely around your body. So usually we'll tie around the waist in some way, but make sure that the back is actually closed as well. Because if you're working in the prep room, you're turning and leaning against the table. You may find yourself exposed to fluid that way. So you want to make sure you're properly covered in a 365 way. And then masks. Now, your masks can vary. You'll see the one in the photo there. That's like an N95 style mask. It's protecting the nose and mouth. In addition to that, you want to add some measure of eye protection. Now, you could use eye goggles. You could use the masks that have the built in little plastic shield that protrudes above that protects the eyes, or you can do the full face style of face shield that you see there. They do sell those in reusable as well as one time use. Those are fantastic. I am a fan of those. Now, additionally, depending upon your situation, you may need to incorporate shoe covers, and those come in a couple different styles. They have the ones that really just focus on covering the bottom and about 3/4 of the top part of your shoe, and then they have some that are more of a boot cover that will actually extend beyond the foot and up to about the knee. Okay. You have hair covers, which was in that opening slide there, that light blue thin material. The hair cover can be useful regardless of length of hair. And then finally, the respirator, and those come in a couple different styles. You'll see full face, half face, all different types of respirators, and those can be helpful, especially when you're trying to filter out formaldehyde fumes and things of that nature. If you're watching this recording, we are not able to play this YouTube video. However, if you access these slides separately, which I will make available, and you want to go through them, this is a fantastic video that was put together by an actual funeral service professional within the context of the funeral home. We're going to discuss basically the same things. However, I figured if you heard it from someone else as well, that would just make it even more entertaining. So if you're watching these slides or going through them on your own, feel free to click on them. If you're using these slides as a training tool within your funeral home, you'll be able to watch that video, which is recommended. So when do we put PPE on? Okay, well, according to OSHA's bloodborne pathogen standard, you're going to use them with blood or other potentially infectious materials, OPIM, if that exposure is anticipated. So anytime you're handling decedents, you're going to need some measure of PPE, whether you are doing an initial transport, whether you are embalming, if you are dressing, whatever you're doing, you should be considering the use of PPE. Now, I know some people do not wear gloves when they're dressing. I've seen that. I personally like to wear gloves anytime that I'm handling a decedent, even after they've been embalmed. That's just me. But you're going to want to have that those available, and then the situation will determine what PPE to use. Okay, and we're going to talk about that as well. So again, anytime you're expecting to encounter blood, body fluids such as mucus, anything coming from the body, saliva, because I know blood is kind of a given, but there are other potentially infectious materials, fecal matter, urine, any of those types of things, spinal fluid, those are other potentially threatening materials. And you want to make sure you're protecting yourself should you encounter those as well. So when you're selecting your PPE, we want to think about how are we potentially going to be exposed and what environment are we in? So, if you're going to be, and this is going back to the body fluids, OPIM, in addition to blood, but all body fluid secretions except for sweat, even if you don't see blood in them, torn skin, even intact skin may have something going on, some type of external sores or mucous membranes, which is, your nose, mouth, eyes. So, anytime you're doing a transport of a decedent, at a minimum, you are going to have gloves on. You may want to think about having PPE in your removal vehicle or transport vehicle should you encounter a situation. For example, if you're doing a transport and the decedent has edema, there's a lot of weepy fluid. If there is purge, if there is fecal matter, obvious urine, things like that, you're going to need more than just gloves, right? So have a gown, a plastic apron, other means of protection within your transport vehicle. If you are doing a transport on behalf of the medical examiner or you're going to a scene that's especially contaminated, have those full body white suits. Even we call them the marshmallow suits, where they even have a hood built into them. You'll see them sometimes in like crime scene documentaries. So have those things available to you even when doing a transport, because you may show up at a scene or at a location and be surprised by the level of exposure that you actually have going on there. Have those things available, and then make an assessment of the environment when you get there. I would recommend wearing a mask over nose and mouth, because anytime you're moving a decedent, when you lift them or shift them about, you may be releasing air from the lungs, things like that. So protect your face. What exactly are you doing? Now, obviously, when you're embalming, you're going to have on the full range of PPE because of the fact you're going to be exposed directly to blood within the means of the embalming process. And when you're dressing, depending on what you're doing when you're dressing, like if you're going into cutting of nails and cleaning of, the mucous membranes and all these other things. Obviously, you're going to have gloves on. You may want a plastic apron or a gown or something on as well, depending on what you're doing, depending on the condition of the person, if you're putting them within a plastic undergarment like a union all. So just kind of assess and never feel like you wearing a PPE, like if other people don't want to wear as much as you, and something is said to you, and maybe you're being extra, just feel free to be extra and do what you are most comfortable with. Okay, it's not about whether people how they choose to protect themselves as much as it is about you taking care of yourself and your family. So select the PPE that's going to make you feel most comfortable and at ease, so that you're able to complete a task feeling like you've done the most you're able to protect yourself. Now, how do you put the PPE on? So I wear two pairs of gloves. I'm just going to mention that. First of all, before you even start putting PPE on, make sure your hands are clean. Go ahead and put your gown on first, okay? Make sure you fastened it at the neck. You may need help. Some of the gowns will have Velcro. Others will have ties. If it's a reusable gown, it'll probably have ties or Velcro also. So just make sure you fastened and tied it at all the areas that you need to, and make sure you get the right size, okay? If it is too small, then you're going to strain the material. It's likely to tear. If it's too big, it can actually become cumbersome and get in the way. Okay. Go ahead and put your mask on. Now, you may have the kind that just has elastics, or it may tie. Make sure that you position it comfortably over your full nose, mouth, and chin. Okay. Make sure if you're wearing glasses that you're able to adjust your glasses so they're not fogging up. Okay. And then make sure it's fitting you properly. Put on your eye protection if you have not, and that can be your face shield, your goggles, whatever it is. Go ahead and put that on and adjust them comfortably. Okay. Some of those face shields are going to be adjustable around your head. So make sure it's not too tight, not too loose. If you are wearing a hairnet or hair covering, I would encourage you to put that on first before you put on your face shield, your eye protection. Okay. I would even encourage you to actually put that on after the gown. That way, anything that's going around your head doesn't compromise the way that hairnet is covering your hair protection. That's just me. If you have a different way you like to don your hair covering or head covering, I'm just telling you what I have found it works best for me. And then you're going to put on your gloves. I like to put on my first pair. The first pair need not be as thick necessarily as the outer pair. The first pair is going to go underneath and be kind of the primary pair. And what I'm going to do is I'm going to make a hole in the cuff of my gown, right behind that cotton part and where it starts to get into that other material. I'm going to make a hole for my thumb, and then I am going to pull the glove completely over that cuff. That white, it's usually white, but that's like a cloth material, which is absorbent. I don't want that exposed so that it can catch liquid, right? So I'm going to put the thumb underneath first so that it's going to have that cuff captured between the thumb and the top of my hand. And then when I put on my second pair of gloves, that pair may be a little bit thicker. I am then going to pull that down over that exposed cuff. Okay. So first pair of gloves goes kind of underneath. It goes through your gown if you want to just create a way to capture that cuff. And then the second pair of gloves, a little thicker perhaps or more textured, is going to go over that cuff. Okay. And then finally, just make sure that everything is in place and fitting comfortably. Now, in the photo you see there, that is what I like to wear when I am embalming. So I have a gown on. I also have a plastic apron, and I wear galoshes that go up to my knee. I tuck my scrubs in. Scrubs are not PPE. Scrubs are can be worn as just comfort. And then also, sometimes when you're working with smells, they'll want to stick to your clothes. So with your scrubs, if they're provided by your employer, they should launder them for you. And those are nice so that you're comfortable. But I like to have those galoshes on. I only wear them when I am embalming. I will wipe them down when I'm done with a disinfectant. And those those shoes do not leave the embalming or work area. Okay, so I would not wear those in the main areas, even though I'm cleaning them. They would stay in a locker room or a separate area. Okay, so that is what I like to wear, but everyone's a little different. Make sure again you are wearing the correct sizes of everything, especially gloves. Okay, make sure your gloves are not crunchy and old. We'll talk about that as well. But just make sure that everything fits comfortably as it should so that you're able to do your work without being distracted. Okay. And then when you go to take it off, you can remove the outer pair of gloves. Okay. You can peel those off and then go ahead and start because the under pair is going to be clean, and go ahead and start removing things. You can start taking the gown off. You can start taking the eye protection off, the mask. And then of course, your shoe covers, all those things. You're going to take your under pair of gloves off last after you've taken everything else off. Now, let's say that I'm going to take off a lot of my PPE, but I'm going to mop the prep room when I'm done. I may go ahead and again, assuming that you're wearing scrubs if you want, or you may leave the initial gown on and just start taking off some of the other items to mop or do some cleaning. Um, you still want to have some basic covering on the feet or those galoshes probably when you're doing the floor. So just kind of take it off in the manner described, but also depending upon what you're doing. And then we'll talk about disposal in a moment. So you see how you're putting gloves on pretty early. You're taking the initial pair off pretty early, but there is again an order of things. The gown is going to go on, then you're going to focus on those items on the neck and above, right? And depending upon your shoe covers, things of that nature, you're going to make sure you have all those things. At the end of the day, to be honest, God forbid you put a piece of PPE on and not in the right order. I mean, it's going to be okay. It's important that you have it on, period. You just want to be mindful of, once your gloves are dirty, then you want to be mindful of, okay, take off the dirty gloves before you start, necessarily messing with everything else. And, just be mindful of so much of that. Now, with your PPE, they are not impervious to tearing, to sharps. If you have enough chemical or liquid on the PPE, like if you're working on autopsy cases and things like that, and you find that you have a significant amount of body fluids or blood on the sleeves, you're probably going to want to change those, even though it's not touching your skin. You want to make sure that you're paying attention to your PPE, again, for tearing and things like that. You want to make sure you're using the proper sizes of everything. And PPE is only as good as its use, okay? So if you're not using PPE, if you're not donning these things to protect yourself, then you're exposing yourself. And should you have an incident at work, your employer may ask you, what PPE were you wearing? Because basically it's a twofold situation. They're required to provide it for you, but then the expectation is that you wear it. So if you have an issue or an accident of some kind, for example, if you have fluid in your eyes and you go to the eye wash and you do all these things and you're filling out an accident report, there's probably going to be a question about what form of eye protection did you have on at that time. Okay. You're responsible for using these tools and resources that are provided to you, and how well you use them is going to be up to you. So just understand that any risk that's there, if you're not utilizing those supplies that are put there to protect you, then you're exposing yourself. You're making that conscious decision. So care, maintenance, and disposal. Disposable PPE obviously should only be used one time. It may not last the full usage time. If you're embalming a case and you find that that PPE is compromised, you may need to change out and get new PPE. Or let's say you're in the middle of a long day in the preparation room and you take a break for lunch. You're going to take that stuff off and you're going to need to put fresh PPE on. You're not going to put on the same gloves or any of that, okay? The only thing you might put on again are those shoes that we talked about, your embalming shoes. Um, your PPE needs to not be stored within the actual embalming room, because ideally you want to be able to put it on outside of that space. Additionally, if you're keeping PPE in the embalming room and exposing it to the fumes of the formaldehyde and other chemicals in the room, it can slowly impact the integrity of the rubber and other materials that they're made of. So you don't want to necessarily have it within the actual embalming room. Now, your respirator, you want to make sure that that's cleaned and stored outside of the embalming room, and it can be within those drawstring plastic bags. It can come and be placed in its box. You don't want to hang it by its straps. You want to make sure that any cartridges you use have been removed and thrown away, and then you can wipe your respirator off with an alcohol swab. You can go through there, make sure you're wiping down the outside and the inside. The one that's shown there is a full face respirator that actually incorporates a spectacle kit. So with that one, it has the prescription for my eyeglasses already built within it. So should I need to use it, I'm not compromising my ability to see. So I go back through there. You're going to have sweat, cosmetics potentially that you have on, or any type of just moisture buildup in there. So you want to really wipe out the inside just as much as the outside, okay? Make sure when you do throw away things like your gowns, your gloves, put them in the proper biohazard containers. Those containers should be marked in such way with the insignia, the bags are maybe red, or the box they're in may be red. Make sure you're throwing things away in those containers, and make sure that those containers are not overflowing. Make sure the containers themselves are not gnarly. And because that, you obviously don't need that either, where things are overflowing. You don't want to have to put your hand into a bio container and push down on the contents to make room. Okay, so anytime it's getting even remotely close to being full, go ahead and package it up, tape it up, and get a fresh one. And then be mindful of the storage and the time that you have PPE. And what I mean is, if you have gloves that you've had for a gajillion years, they're going to break down over time, and they're going to get crunchy and brittle, and they're not going to work well. Okay. So when you're placing your orders, just like with fluid, right, make sure that you're mindful that you're using the older product first. Okay. And put dates on boxes, put dates on the gloves. And what that's going to do is just help you keep track of just how old those items are. If you are using reusable gowns, make sure that those are placed in a specific hamper container that is labeled and associated with biohazardous linens. Okay. And make sure too, if it were me, I would not wash my gowns in the same and this is just me. I would not want to wash them in the same load of laundry as like soiled sheets and stuff. I mean, it's fine. You probably can. I'm just weird about that. Either way, as long as you're washing them. And don't wait and wear them like 6 and 7 and 8 times and then decide to wash them. Once they have blood or something on them, once you've used them and you've embalmed in them, go ahead and put them in the hamper. Have them hanging outside of the prep room as well, so that you can put them on before you go into the actual embalming room. Okay. Um, and then, of course, if you're using those galoshes, like I showed you, wipe down the outside of those and store them outside of the prep room, but not in the common areas. Okay. So that's going to be a good way of taking care of and maintaining your PPE. If you have a crack in something, even after you've taken care of things like your respirator, anytime your edges are becoming cracked or compromised in any way, when you're checking for your seal and your seal's getting worn, anything like that, go ahead and get another one. Okay. Your cartridges, same thing. Those aren't made to be used for over and over again. Make sure you're replacing those. So finally, things to think about. Your PPE, it's not just about you. It's going to keep you safe, but also your family and your coworkers. And I think that's important too. Be thoughtful about other people around you and combine it with good housekeeping. When you're done in the back in the preparation room, make sure you're cleaning the room behind you, okay? Because if a person steps in there, they shouldn't have to worry about dry blood or fluid on the ground, any type of chemical spill that's still out there, near your machine or something. Just make sure that PPE is used in conjunction with proper disposal of fluid bottles and just keeping your preparation room in general clean. Make sure you're using engineering controls that are available to you. So, are you turning on the vent fan? Okay. Yes, it gets warmer in there with the fan on. However, it's going to help pull a lot of that contaminated air out of there and replenish your air supply with fresher air. So, yes, make sure you're using that when you're dealing with chemicals and things like that. Make sure that you are keeping your table rinsed to fluid. Make sure that if you have the system where your drainage goes into like the urinal style commode, you're flushing it routinely. If you have drainage going into a sink, make sure your sink is not getting backed up and that your drainage is not starting to build up in there, that your plumbing is in good shape and condition, that there's no clogs and things of that nature. And then make sure that your new hires, your new employees and new team members understand how to use PPE right out of the gate as well. Okay. Make training and educating them on this part of that new employee onboarding process. Okay. That's very, very important. So finally, I thank you for your time. I hope you found this useful. And if there's a training topic that you would like to have explored and have some material created that could be of use to you and your team, let me know because I like to create content that's publicly available for folks that they can incorporate into their own training regimens and help educate. I think educating each other is important. So if I can help you with that, or if you have any other questions, that is my Linktree link there. You'll find my email and a lot of other materials I've made, my YouTube channel where this is going to be posted. So if I can be of assistance to you, please let me know. And I appreciate your time. Thank you.